Let's talk about NASH, because NASH is, from the statistics that I've seen, that there are groups of people, in some cases with the SAMI deficiencies and certain things that you've brought up in the the 4-hit hypothesis, so to speak, that do actually or can develop NASH within about 36 months.
As fast as that, wow.
And this is obviously a smaller percentage of the people with fatty liver, and I don't want to be too hyperbolic about it, but getting liver fibrosis can actually happen quicker than we may think. And I think some of the things that we've discussed previously on the podcast is that if you're seeing someone once a year for their wellness checkup, and they're like, here I am.
And you're missing homocysteine as a measure.
Okay, right.
And you didn't bother with HbA1c because they're not diabetic.
Indeed. So you're missing certain points. So you see someone for a wellness checkup, their yearly checkup, here I am, sir. I've just had my 50th birthday. Everything's going great. And then you see particular levels that suggest, hey, you've got a mildly fatty liver. I'll go, okay, well, please look after your diet, maybe reduce your alcohol. This is especially the case for men. Look after your alcohol, try and pull back on some of the treats and bits and pieces. They go, yep, okay, all over it. You don't see them for 12 months. So you could be 33% worse in some cases with that fatty liver. And then, once again, if it's, the fatty liver's set in, we've really got to do some work now with your diet. If they don't do that, you may not see them again in 12 months, again on top of that. And you can see where if you can't coach your patients into this change, you don't get many opportunities to do that until it might be too late.
I do relatively aggressive changes, even with fairly minor stages of all of this process. So I'm educating the patient pretty quickly. It's like, this bit of insulin resistance you're showing with the high HbA1c might be the only number I've got to go on, and then I see their triglycerides are up and their LDLs are sneaking up as well. And you say, well, look, you've got the beginnings of the whole process of fatty liver and cardiovascular disease. Would you like to reverse that? Okay, yeah, I'd like to reverse that. Well, let's get a fibroscan done of your liver, and let's look at the numbers. Okay, so you get a fibroscan done, and it's like, yeah, they've just got a fatty liver, or they haven't. So let's then talk about the NASH case. So in the fibroscan, what's happening is, if they're okay with their density of their liver, the number comes back at something like 6 and better under that. If they're at the edge of cirrhosis, it's 12 and up. And so you've got this range of somewhere in the 6 to 12 where they're developing NASH. And essentially with NASH, you've got extra oxidative stress going on in the liver, so that the tissues are actually burning, if you want to put it in broad sense. There's a lot of inflammation going on. So who's likely to be those patients? Well, it's the ones where the liver enzymes are up.
Yeah.
Okay, so those patients are going to need more aggressive detoxification, probably SAMI, maybe NAC. I probably generally give NAC over glutathione, I think. The reason being that the body can work out where it wants to put stuff. If it's using NAC on the vascular support, it's using it there. If it's going into the liver and converting it into glutathione, well, great, it can start dealing with the methylglyoxal and reducing that so that the insulin resistance goes down, the cells are not so under attack, and it can start picking up more of the toxins, so it can use its wisdom to allocate where it needs it. But what I'm finding hard at the moment to work out personally is, when do I rely on just something like the homocysteine supreme, a good B complex which gives extra support for homocysteine reduction, or when do I give SAMI? And I haven't quite got a firm line on that yet, excepting when I see red numbers, I'm giving SAMI, because it's like more dangerous. And I don't know quite where the middle is as to when I have to go from one to the other, or to include some SAMI on top of homocysteine support yet in terms of numbers. But the reason I'm having such a kind of big brain dump here, and it's meant to be confusing, this discussion is meant to be confusing. I've deliberately left it vague in the sense that it's important we understand the processes, and we're looking for the signs, and that we can at least approach it with an inquisitive mind that's kind of like trying to work it out on behalf of this patient. And so when it comes around to the answer to the question, if you've got a fibroscan, you can enroll the patient pretty quickly into, let's get this number of the fatty component down in, let's say it's going to take 4 months or 6 months. And the fastest I've seen a nice change so far in the fibrosis score. Like, I had a patient of 12 recently, and he'd been doing my treatment with berberine and pantethine and phosphatidylcholine as a basis for the fatty liver component, but he'd seen Dr. Chan with a FibroScan independently of my referral some 3 months back, and he'd been chugging along on my program, and back at the beginning there he had a FibroScan of 12, and Dr. Chan said, "Oh, that's pretty high, that's right on the edge of cirrhosis, let's give you some of this nice vitamin E complex I've got." He happens, Dr. Chan, to be on giving people not a Natto-E, but a formula with the tocotrienols, not the tocopherols, which technically they're more active in the liver. Okay, happens to be on that. Just a reasonable dose, not excessive dose. And his FibroScan came down over the time while he was on my treatment and the additional vitamin E 3 months from 12 down to 6.
Wow.
So he came out
that's a 50% change.
Came out of basically the edge of cirrhosis into pretty close to not having NASH anymore.
Wow.
In just 3 months. So that's putting most of the bits together. So he was on the bits for me, and then he added the vitamin E. Luckily, it was identified. I hadn't been using the FibroScans quite as readily, but it kind of turned me on to, I need to do the FibroScans.
Yeah.